Happy Friday to you. I'm sitting here with Dr. Murphy, and he's going to answer your questions, and that's what Free Advice Friday is. So, welcome to the party, people. Dr. Murphy, are you ready for these questions?
I'm ready.
All right. So,
Can't you feel the excitement, the enthusiasm in my voice?
Yes. This feels excited for you, what your enthusiasm level gets to. This is
Come on,
peak.
let's start the freak show.
All right. Your first question, sir, is this. Actually, these are your only questions.
Good.
People want to know what are the most commonly asked blood pressure questions.
I think probably the most important one and probably the most common one is what defines high blood pressure. Years ago, 30 years ago, anybody with a blood pressure consistently 140/90 or higher was considered high. And it has to be consistent. It's not a one-time reading. I mean, you can't drive down range line traffic in the middle of the day and expect your blood pressure to be normal. I mean, that's not going to happen. Or, God forbid, sit in a doctor's office for 3-4 hours and expect your blood pressure to be normal. So, but taking it at home, and I think that's a really good important tip, is to take your blood pressure at home, but consistently above 140/90. Recently, about a year or two ago, they came out with some new guidelines that says, no, it needs to be 130/80. I tend to be a little bit of a conspiracist, and I think the reason they're lowering it to that level is so everybody in the country can be on blood pressure medicine, so we can all pay the pharmaceutical companies more money for blood pressure medicines. The interesting thing is there's some good techniques to treating blood pressure, but understand this, the generic medicines that are out there, and they're relatively inexpensive, work very, very well to treat blood pressure. So you don't really need these newfangled blood pressure medicines like Bistolic and stuff that cost $300-400 a month.
Yeah.
Generics can be easily substituted for it and they work just fine.
That was pretty good information.
Yeah, well, I thought so. But the most important thing is what's the upper number? What's the upper number? And if you're 45 years old, you come in, your blood pressure's on 95/60. Congratulations, you got the blood pressure of a 12-year-old, and you're going to live a normal, healthy life. So there's really no such thing as a low blood pressure, but that upper number is something to be concerned about.
Yeah.
And a lot of people with blood pressures, Michelle, in the 170, 1/140 range, they don't have any symptoms. And that's why they call it the silent killer. It kills you over time.
Yeah.
So 20, 30 years of blood pressure like that, guarantee you're going to have a stroke, going to have a hemorrhage in your head, going to bust a blood vessel in your chest, and you're going to die. So it is something.
You're going to what?
Die.
You said it like the alien. You said blood pressure in your chest.
And you wonder why I like making these videos.
That's like Sigourney Weaver. There's an alien in your chest.
Thanks, Michelle. I'm sure this is real informative for people.
It's going to burst its way to your chest.
Yeah, this is real informative. Thanks.
Die.
Why don't you leave so I can do this video?
Okay. All right, well, what do you think? Any other questions people come up with?
No, that's actually the big ones. And the most important thing is for people to keep track of their own blood pressure. I mean, don't rely on
and
doctor's
don't
office.
run out of medication, because I feel like
especially for a DOT physical. I can't honestly tell you how many times I wouldn't have enough hands if there was 50 of me to count how many times people are like, well, I forgot to take my medicine today. Okay, of all important days, take it.
Yeah, seriously.
Take it today.
Or people wait till the last minute to fill it. And, you might have someone you can go to fill it last minute like that. But just try to keep up, not only just blood pressure, but anything like that that's like, can really affect your day. Blood pressure is one of those things you want to make sure you stay on top of. Don't wait till you run out to call it in, because the doctor may not be able to get you in.
We want to see you guys around because we like the fact that you irritate everybody in the world. So we need to see you.
All right.
So,
what do you think? Is that about everything about blood pressure? Well, not everything, but good.
Let's move on to the next question.
That's all your questions.
Oh, great. End of the show.
I was going to ask you something about Care Credit, but I think I'm going to wait.
Good.
Because I have all kinds of information, and I want to make it a longer video to address Care Credit, my opinions on Care Credit, and see what you think about Care Credit, because I don't think it's all it's cracked up to be.
Imagine that.
Anyway, that might be a good trash talk, or maybe just a myth buster. So,
okay. Have a good Friday.
Have a good Friday, guys. Enjoy your weekend. Share this video, or don't share this video, but be sure to take your blood pressure meds, yo.
To eliminate some confusion, my number's still 140/90. Until I see...
Oh, that's you're going to give out your phone number.
No. Until I see some different information that says that it really needs to be lowered. I'm still going to go with the 140/90, not the 130/80.
Cool.
So,
That works for me.
have a good Friday.
Have a good Friday.